dollar is 45. Sa atin, baka mga 44 na lang.
Can we begin?
We are now live.
Okay.
Yes, sir. We are now live on Facebook.
All right. Thank you, Ado. So good afternoon and welcome to another webinar, which is presented to you by the Ateneo de Manila Department of Sociology and Anthropology and the Anthropological and Sociological initiatives of the Ateneo or Asia. No? So this is a seminar series on the web, and this is the third installment for the first quarter of the first semester of 2019-2020. No? Our webinar conversation for this afternoon is entitled Implementing Informed, Innovative, and Inclusive Responses to the COVID-19 Pandemic. And the webinar basically seeks to draw substantial insight, no, from the experiences and interventions of researchers, public health practitioners, academics, activists, and elected officials currently spearheading programs and projects meant to mitigate the multidimensional impacts of COVID-19. It also aims to highlight how pandemic preparedness requires data-driven and context-sensitive approaches that are imagined, crafted, and implemented collaboratively, no, across societal sectors involving multiple actors. This afternoon, we are honored and privileged to have with us two distinguished resource speakers. No? Our first speaker this afternoon is Dr. Dennis Batangan, and he will be talking about, or his talk or presentation is entitled Transforming Digital Spaces for Adaptive Learning in Support of the Pandemic Response. No? Our second speaker for this afternoon is Mayor Webster Litargo of the Municipality of Gomaka. So he will be talking about building solidarity amidst adversity. So fighting COVID-19 through shared responsibility. Okay. So before we begin, I would just like to read some house rules, no? Which will help our resource speakers as well as our participants. No? So kindly ensure that your microphones are turned off during the session, especially when the speakers are presenting. We would also like to request participants to turn off their video cameras to conserve bandwidth. No? We encourage participants to engage with the speakers through the chat box. Note that we will only be able to accommodate a considerable number of questions. No, we actually have an open forum later on, and we will be mindful of the time, but rest assured that we will attempt to accommodate all your questions so that we will have a more dynamic and engaging conversation with our resource speakers. Also, we would like to invite you to close any running notifications or apps to avoid experiencing internet disruptions or video lagging. And we would also like to invite you to please put your screen on speaker view. No? So to begin, our first speaker is again Dr. Dennis Batangan. He is currently a research associate at the Institute of Philippine Culture of the Ateneo de Manila University. He is a distinguished medical practitioner and public health specialist and has been a prime mover, no, as far as delivering important, insightful, and informative online conversations, no, via his We Can Ituro program, no, is concerned. No, he has been very active. He has been, shall we say, at the forefront of this campaign to maximize online learning platforms. And Ateneo and IPC are very thankful for his initiative. So without further ado, we would like to invite Dr. Batangan to give his presentation, which is entitled Transforming Digital Spaces for Adaptive Learning in Support of the Pandemic Response. Dr. Batangan, good afternoon, and thank you for gracing us with your presence this afternoon.
Thank you very much, Nino, Dr. Nino, and greetings to my co-presenter, si Mayor Litargo, who has been one of our guests, no, in one of the webinars that Nino was describing. So magandang hapon sa ating lahat. Thank you for the opportunity to share this experience, no, with regards to how we are using or started using e-learning platforms for adaptive learning in support of the pandemic response. Um, uh, in this opening slide, no, you'll see that there are several images. On the lower right, no, when you're facing the slide, actually is the logo of the Department of Science and Technology, Philippine Council for Health Research and Development, who has actually supported a lot of the work that we're doing at the IPC, including eTuro, which I will be explaining in a bit. And the other e-health or techno governance projects that we're doing, EHATID and of course eHealth PH. So next slide, please. So the presentation would be focusing on these four main areas. No, let's the COVID-19 as an override, no, in terms of the work that we're doing at the IPC, and I think for everyone's professional and personal lives, no. We were doing a lot of work on universal health care, no, before the pandemic pandemic situation we had around February to March, no. And I'll briefly discuss this, and then also the research work that we're doing under the National Unified Health Research Agenda, and how we tried to respond to these challenges through the eTuro We Can series as a techno governance project to support adaptive learning in this time of pandemic. Next slide, please. So we were actually doing, as I said earlier, some work on universal healthcare, because we had a very significant development in 2019, the approval of the universal healthcare law, as you all know. And the preparations then were on the universal healthcare in terms of the e-health governance and the techno governance work that we were doing. We were hosting some discussions on universal healthcare, and then the pandemic struck, no, the COVID-19. And from then on, around February of this year, we were bombarded actually with information such as this one regarding pandemic, the number of cases, and we're still bombarded until now of the body counts, no, and the figures that are coming out from different agencies and different institutions and different research institutions. So next slide, please. So what is the universal healthcare? The universal healthcare is actually a reform agenda for the health sector, which affects, of course, the entire country. Meaning the goal is for universally accessible health services that is quality, affordable, and accessible, no? And within that particular context of the universal healthcare law that was approved last year, the role of e-health, no, or stands for electronic health, was identified and was highlighted actually, because it forms part of the services delivered as well as the governance mechanism of the universal healthcare law. Can I have the next slide, please? So briefly, this is how it looks like, no, in terms of the diagrammatic representation of the universal healthcare law. So you would see here that the middle actually are the citizens who should be provided with health services. But for them to be able to be provided with these health services, they have to go through a certain process, no, or a certain mechanism or referral process to be able to be provided with those services. And a lot of those processes are intermediated by electronic processes or electronic medium, or what we call as e-health. So for this particular set of or cluster or set or community or members of a community to be able to access services, for example, to higher level facilities, they should be referred. They should go through a certain provider network mechanism from the lowest level or lower level facilities. That means the barangay health station or the rural health units or a private facility. They should be referred to the next level facility until a referral to the apex hospital if needed. And in this particular diagram, you'll see the major role of PhilHealth, no, or the Philippine Health Insurance Corporation in providing the financing, no, for the delivery of services. But as we were doing the preparations for this healthcare provider network for the universal healthcare, we experienced the pandemic, no. So everything that we were preparing then, no, was actually sidelined, and the focus of the healthcare system was mainly on the response to the pandemic. So whatever resources, whatever preparations that were actually being set up were actually redirected to the efforts to contain the pandemic. So next slide, please. Parallel to that process of the universal healthcare development and implementation, preparation for implementation, the work that we were doing at the Institute of Philippine Culture in Ateneo was actually anchored on the National Unified Health Research Agenda, which is actually the national research agenda on various issues on health, no? And it is part actually of a bigger research agenda called the Harmonized National R&D or Research and Development Agenda, which supports the overall development plan of Ambition Natin 2040. As you will see in the diagram, the health component of that harmonized R&D is what we call the National Unified Health Research Agenda, of which the e-health work that I'll be describing briefly are part of and supports actually supports, of course, the harmonized R&D and of course the goals of Ambition Natin 2040. Next slide, please. And what was that particular context of the Unified Research Agenda in universal healthcare? The context was on techno governance. No, when we say techno governance, we would like to see the adoption, development, and utilization of technology within the context of a broader health governance issues and objectives. So that includes, of course, the policies and guidelines, no, on e-health. It includes the specific processes that should have been or could have been or should be enhanced by electronic means or electronic modalities, and of course the component on e-learning, no? Because as we all know, the e-health and the technology behind e-health is actually the same technology that is used for e-learning. And for these particular technologies to be adapted and to be used more efficiently, we also can use the e-learning platforms or the technologies to be able to provide capacity building or inputs to the health workers and also to the citizens who will be availing of these services. Next slide, please. So what were we doing in the universal healthcare arena? No, as the project called eTuro is actually on the use of e-learning platforms for health concerns or health issues, we started a series on universal healthcare on these particular topics. No? We started even last year. This was in partnership actually with the Philippine Health Insurance Corporation. And we were explaining, or we started some sessions or some discussions on the basic concepts of social health insurance, on the primary care benefit package, on the health information system, and we were planning actually to do a series on this, and then what we had eventually at that around February was COVID, and we shifted immediately from a focus on the universal healthcare. We shifted to a more operational topic on COVID, no, which I will list down or describe a bit later. But we continued still, no, with the discussions on universal healthcare. So until February, and actually latter part of February, and also in March, we were doing some discussions on universal healthcare. The photo here actually was the last webinar that we did inside Ateneo campus, no, wherein we had a discussion with former UH Secretary Manolet Dayrit, no, on laying the groundwork for UH implementation. If you remember, this was the week actually that the lockdown started. So after the week of the 12th and 13th of March, no, we were actually all in quarantine, from the general community quarantine to enhanced to different variations of the quarantine procedures. Next. So next slide. Yeah. So in addition to the discussion on universal healthcare, we also started a series of discussions on primary healthcare, because we were also looking at how universal healthcare and primary healthcare actually could contribute to the discussions on the pandemic. As you will remember, or as you have noted, no, during the early days of the pandemic of COVID-19, a lot of the discussions were on the technical issues around the virus, around prevention measures, disease control measures. And we felt then that a discussion on the health system and then the approaches actually to the healthcare delivery system would help us in understanding the context and the responses that we need to implement, no, for COVID-19. So we had two successive discussions on primary healthcare and universal healthcare, no, with speakers from Ateneo, from the Philippines also, and from colleagues outside the country. So we have here the first one with Dr. Susan Rifkin from University of Colorado, and of course Dr. Mary Racelis from Ateneo, which was facilitated then by Dr. Jaime Lau, Melissa. That was followed by another webinar also on the same topic with Dr. Soe, who is from Myanmar, but who worked actually with the WHO, and Dr. Madeline Valera, who was a former senior government official and also a faculty at Ateneo Professional School, facilitated by Miss Jessica Claudio. Next slide, please. And what was the experience so far? No, this is just to give you a preview on the numbers. No, when we started around COVID-1 around February, we were actually around 200 or 300 participants, no, for the webinars. And over time, we actually got more and more participants. And when we sort of checked, no, or when we reviewed the numbers around end of June, there were already 24,000, more than 24,000 attendees, no, to these webinars. And then we reviewed again, no, last week, as of September 15, these various webinars since February until last week already had 41,000. 467 live attendees. No, so this shows us, no, the interest and the the time people spend, no, for this particular webinars. At this point, I would just like to share, no, some of initial findings that we had, no, with regards to these webinars on the context of adaptive learning. I don't have slides for this, no, because this is still a very fresh study that was actually done by our research interns at the Institute of Philippine Culture, Marian Galvez from PUP and Agham Navarro from Ateneo. So they did actually a review of around 10 webinars, no, that we conducted on the context of social determinants of health. No, that was the main frame for the different topics that we were conducting. They analyzed 6,179 chat logs and 4,313 evaluation responses. I won't go into the details, no, but just highlight some of the main themes, no, that were gathered, no, from this analysis using content analysis. So a lot of the topics, for example, were on COVID-19, no, which was mainly on the or some on the virus itself, on the transmission, and then on the control measures. The next major topic that was gathered, no, from that analysis was on individual and community well-being. No, a lot of the questions and responses were on individual and community well-being, and the main issues that were discussed then were on generally termed as mental health issues or psychosocial health issues. A lot of topics or a lot of questions also on its effect on work patterns, no, on individual individual work patterns. And another major cluster was on individual issues with regards to the COVID situation. The next major cluster was on quarantine issues, and again with the analysis of those 10 around 10 webinars, the main things that people or respondents were talking about quarantine issues were the variations in the protocols, including issues on the new normal and the expectations on social distancing, and also a lot of questions on the effectiveness, no, of these protocols. So we actually were seeing a lot of the questions and also the discussions during the webinars is a form of people trying to understand what was happening and people trying to understand what needs to be done in terms of preventive measures, what needs to be done in terms of new work patterns or new behavioral expectations, and what needs to be done in terms of work-related or work issues, no. And for a lot of these particular topics, we were getting some feedback in terms of how people appreciated the fact that they were discussing the pandemic and COVID-19 with different lenses, no? Not only from the biomedical or the public health lens, but they were also looking at the issue of the COVID pandemic in terms of psychosocial lenses, specifically looking at individual situations and also community situations and also work situations. I think that is the last slide. If there would be any questions later, I'll be happy to answer them. Magandang hapon pong muli and maraming salamat.
Thank you very much, Dr. Batangan, for an insightful and informative presentation. We will definitely get back to you for the Q&A later on. No? So for our second speaker this afternoon, we have with us Mayor Webster Litargo of the Municipality of Gomaka, province of Quezon. So Mayor Litargo was born on the 20th of December, 1973 in Manila City and completed his primary and secondary education at the Gomaka West Elementary School and the Gomaka National High School, respectively. He is serving his first term as municipal mayor of Gomaka in the province of Quezon under a campaign banner of an open, honest, and caring government where citizens come first. In his first year of service, he established a one-stop shop called Kalinga Center to facilitate medical and health assistance. His administration also created the Public Information Office that provides accurate, relevant, up-to-date information and engagement with citizens about the LGU's projects and activities through its radio program and Facebook page and live events. His career in public service spans 25 years, having been appointed Chief of Staff of the Office of Governor David Suarez for 3 terms from 2010 to 2018, leading the planning and delivery of social services across the province of Quezon. Mayor Webb has also served as political officer for Danilo Suarez in the lower house and for Senators Francisco Tatad and Senator Santanina Rasul in the upper chamber. As municipal councilor in Gomaka from 2001 to 2004, he co-authored and passed at least 300 local legislation benefiting disadvantaged sectors, including farmers and fisherfolk. He is an active member of the Kaya Natin movement since participating in the Leaders for Excellence in Public Service Mayor's Fellowship Program from September 2019 to March 2020. He graduated from San Beda University with a BS Accountancy degree in 1995, where he began serving as a youth leader. He became one of the youngest consultants of the National Youth Commission and was among the youth legislators in the first National Youth Parliament in 1995. Together with 43 Filipino youth ambassadors, he was selected to represent the country in the 1997 Ship for Southeast Asian Youth Program with delegates from countries in Southeast Asia and Japan. He is married to Justine Espina Litargo and blessed with 2 children, Isaac and Pio. So without further ado, we welcome Mayor Litargo. Good afternoon and thank you for accepting our invitation, Mayor.
Sir, good afternoon, Sir Nino, and also to Sir Dennis sa ituro at sa lahat po ng nandito sa programang ito ng Ateneo. Ito. Yung isi-share ko. Ito. Sorry.
Okay lang po, Mayor.
Baka mali eh. Yeah. Okay. Good afternoon. I will be presenting yung aming ginawa to fight COVID-19 through shared responsibility. What we do is we build solidarity amidst adversity. Ang outline ko po is introduction of my hometown, mission and vision, ang status namin ngayon ng COVID-19, and then yung programs namin kontra COVID, and yung amin pong ipinagmamalaking Gomaka Cares. This is COVID aid reporting and expenditure summary. And then yung aming mga personal lessons and challenges moving forward, and ano yung nakikita namin what will happen in 2021 and what we can do dahil dun sa mga ganitong problema. Well, ang Gomaka po ay itinatag noong 1582. We are an old No. Dali lang daw po.
Sige lang po, Mayor.
Well, Sige dyan. Okay, ulitin ko lang po.
Sige lang po.
Yan. Okay, sorry for that. Ang bayan po namin is a first-class municipality with 59 barangays, and now we're almost 80,000 ang aming population. We've been the recipient of Seal of Good Local Governance and Good Financial Housekeeping, at saka po yung child-friendly local governance. Okay. We are the center of economy in the 3rd and 4th District of Quezon. Nasaan po yung mga bangko, mga national offices like the BIR, PhilHealth, and DAR, Agrarian Reform, LTO. And also meron din po kaming mga ospital dito na kung saan ang mga kalapit bayan namin ay sila mismo ay dito nagpapagamot sa aming bayan. We have our environmental project dahil kami po ay katabi ng dagat at may mga ilog kami, so lagi po kami may coastal and river cleanup at pagtatanim po ng bakawan and fruit-bearing trees. Ang amin pong turismo, dahil kami ay matandang bayan, meron po kami, sa amin po ang isa sa pinakamatandang simbahan sa aming lalawigan at meron kaming museum. We have our fiesta every November 12. And also, sinicelebrate din po namin ang San Isidro Labrador. We call it Aranya at Baluarte. It is, kasabay po siya nung sa Lukban na pahiyas. Ito po ang aming mission and vision. At makikita niyo po yung aming view ng aming kastilyo overlooking Lamon Bay. Ang aming pong COVID status since last night, ito po ay walang bago na case at zero recovery, but we have 131 confirmed case. 29 po ay active na cases at 102 na po ang nakaka-recover. Ang maganda po rito, at hopefully matuloy-tuloy namin ito, ay wala pong mortality na nangyayari sa aming mga COVID-19 patients. Nung nagdeklara na ang ating Pangulo ng lockdown, March, binuo agad natin ang Municipal Task Group at ito po ay binubuo ng response cluster, health, governance, economy, law and order, food and non-food, logistic, management of the human remains cluster, and crisis communication cluster. Dito po namin nabuo ang aming 4-pillar strategy. Alam niyo po, ang aming bayan, hindi po ito kayamanan na bayan, kaya kailangan namin talagang siguraduhin na ang aming resources, ang aming pagkakagastosan ay nakaplano. So we have 4-pillar strategy: health and safety, food security, economic recovery, and support to vulnerable sector. Sa health and safety po, pagkadeklara pa lang ng lockdown sa buong Luzon, namigay na ho agad kami ng health kits, thermal scanner sa aming mga barangay health emergency response team, yung pong BERT. At sila po ang nagmo-monitor ng PUM and PUIs. At kami po ay tuloy-tuloy na nagdi-disinfect ng ating mga public places, major streets, thoroughfares, palengke, etc. At in-implement po namin yung ating directional arrow sa aming mga main sidewalk para hindi ho nagkakasalubong ang aming mga kababayan. Na-feature pa nga po kami sa Manila Bulletin. Nagturok din po ng free flu and pneumonia vaccine at saka meron kaming rapid testing para sa aming mga frontliners. Kahit wala pa ho kaming positive cases noong March, April, May, 3 buwan po, wala kami nagiging positive case. Pero itinayo na po namin, na-convert na po namin into an isolation facility, yung pong aming Gomaka Evacuation Center. Ito po ay kaya 26 na pasyente na ngayon ay nagagamit namin. Ang provincial government naman po, kinonvert yung aming Southern Quezon Convention Center. Kung makikita nyo po, malaki po yan. At kasya po rito ang 56 na pasyente. Pero ito po, hindi lamang para sa aming bayan, kundi para sa mga karatig bayan namin. Nakapaglagay na rin po ang probinsya ng Quezon para sa testing, molecular diagnostic laboratory, para po mabilis ang balik ng resulta. Hindi po katulad dati, 5 days. Ngayon po ay 24 to 48 hours lamang. Alam na po namin ang resulta kung positive ang pasyente para po sa contact tracing at para na rin po sa isolation. Dahil po noong nagkaroon ng lockdown, umisip po kami ng mga pamamaraan para maisagawa ang makuha ang pangangailangan ng aming mga kababayan. May mga gamot pong binibili ang aming kababayan sa city ng Lucena, mga 1 hour from here. So dahil wala akong public na sasakyan o biyahe, nagkaroon po kami ng pakisuyo program. Dahil din po ang aming municipal health officer ay hindi napupuntahan dahil nga po naka-lockdown, nagkaroon ho kami ng online consultation dito sa aming bayan at ganoon na rin po, meron din po kami na Dance Fitness Live. Ito po yung Zumba na kung saan marami po ang nanunood, marami po ang nag-exercise dahil nasa bahay lang sila. As you can see, nabilugan namin dyan, 74,000 ang people reach nito at 30,000 views. Makikita nyo po, meron din kami na concert, live from home, at saka po, yung makita nyo may upuan ni Kuya, yan po ay yung mga nahuhuli sa curfew. Yung mga lumalabas ng walang quarantine pass, dito po namin sila nilalagay. Para po malaman ng aming mga kababayan, ginamit namin ang social media using Facebook. We use also yung radio station natin dito sa aming bayan para po masabihan namin ano ang mga dapat gawin, ano ang mga pagbabago sa mga containment zones, para rin po inform sila ng mga nangyayari at nagaganap sa ating bayan. Ginawa po namin nung nagbukas na, nagkaroon na po, naging MGCQ na po ang lalawigan ng Quezon, pero naglagay pa rin po kami ng local zoning containment strategy. Halimbawa po, ang isang lugar ay merong nagpositibo para masiguro namin na yung mga kalapitbahay ay hindi mahahawa, nila-lockdown po namin sila. Hindi na po siya 14 days, ginagawa po namin kapag na-clear, naalis namin doon at na-isolate yung mga positive at na-clear yung mga iba pa, nabubuksan na po namin yung kada barangay. Kaya lang po, sinisiguro namin na sigurado na wala na pong makakahawa o mahahawa doon sa lugar. At dahil nga po sa ekonomiya natin ay bukas na, meron na po kaming ginawa na ito meron yan, marami nito sa Metro Manila, itong QR code. Pero dito po sa aming bayan, ginawa po namin ito at lahat po dito, Ultimo Sari-Sari Store, nilalagyan namin ng QR code. Makikita nyo po, McDonald's, Bangko, PNB at iba pa. Pero yun din pong maliliit na pinupuntahan ng aming mga kababayan, nilalagyan din ho namin ng QR code. Para naman po sa pillar ng economic recovery, pagka-lockdown po, siniguro namin, may mga nawala naman trabaho, ay mabibigyan namin ng trabaho. We appointed 388 health warriors, yun po yung tawag namin. At ito yung inassign namin sa mga checkpoints, public areas, major thoroughfares. At kung saan, sila po ay yung mga bus vendors, bus drivers, jeepney drivers, tricycle drivers, at iba pa ho, no? Yung may mga street vendors natin na wala namang mapagtindahan ng panahon ng lockdown, sila po ay inimpleyado namin sa pamahalaan bayan. Ang mga kababaihan naman po, aming pinagtahi ng ating personal protective equipment, yung mga PPEs. At ito po yung binibigay natin sa mga ospital, health facilities, at mga barangay health emergency response teams po natin. Nung matapos na po ang lockdown, bumalik sila sa kanilang mga negosyo, mga walang puhunan, or kailangan mangutang para madagdagan ang kanilang puhunan. Dahil po hindi rin naman kalakihan ang aming pondo, para marami rin po kami maserbisyuhan, naglagay po kami ng programa na puhunang pangnegosyo para sa Gumakenyo. Ito po, walang monthly interest, walang collateral, payable in 1 year. Napakaliit lang po, paghahati-hatiin mo siya for 12 months. Ang kaibahan nito, hindi na nila kailangang umutang sa mga loan sharks, yung 5-6, o yung iba pang nauutangan na may tubo. Dito po, madadagdagan ang pondo nila ng walang collateral at monthly interest. Para naman po sa pillar ng food security, siniguro ho namin dahil nung nag-lockdown, ang mga farmers namin maraming mga gulay, talong, ampalaya, okra, na kanilang na-harvest pero walang mapagdalhan. So kami po ang bumibili at ito po ay pinamimigay namin parang relief goods sa aming mga kababayan. Binigyan din uli namin sila ng vegetable seeds para makapagtanim po sila para may tuloy-tuloy po kaming pagkain sa aming bayan. Meron po kaming gulay bike patrol, inihahatid namin itong mga pananim na ito at saka nilagay namin ito doon sa rolling stores namin. Ganon din po, ito rin yung pinamimigay ng mga backliners. Nabanggit ko po yung backliners. Play of words po yun sa frontliners. Itong mga backliners ay mga LGBT, miyembro ng LGBT community na kung saan sila ay nakagown, namimigay sila ng talong, ampalaya, kalabasa sa mga doorsteps ng aming mga kababayan. Nakakatulong din po ito para lumigaya sila at maalis yung problema sa mental health. Sa ginawa po namin ito, na-cover po kami ng Philippine Star, Manila Bulletin, GMA News, pati na rin po ng iba pang mga media dito sa aming lalawigan. Bahagi rin po ng aming food security. Dahil nga po sa dami ng mga tanim, wala nang bumibili, nakipag-usap po kami sa BJMP. Ito po yung kulungan dito sa aming bayan. At sinabi namin na kung pwede yung amin na lang mga farmers ang magbebenta o bibilhan nila ng mga gulay. Direct na po, hindi na nila kailangan pumunta sa ibang bayan, kundi kami na magsusupply sa kanila. At nakakatuwa po dahil mabilis umaksyon ang aming BJMP at yung Gomaka District Hospital, direkta na po nilang binibili sa aming mga farmers. At ito po, si Benito Cocoy Postre, siya po ang Pangulo ng Malayang Aniban sa ikaunlad ng Sakahan. Sila po yung mga corn grower sa aming bayan at tuloy-tuloy po sila na magtanim. Sinusuportahan namin sila, nagbabayanihan sila para hindi maputol at hindi mawalan ng gana ang aming mga magsasaka. Pagdating naman po sa support sa vulnerable sectors, yung pong aming mga birth ay aming binigyan ng hazard pay. Ganon din po ang ating tricycle drivers, mga porters dun po sa ating port, ganon din po retired teachers, bus vendors, at LGBTQ community. Yun naman pong mga locally stranded individuals natin na iwan hindi makaalis ng Manila, nasa Cavite at sa iba pang mga lugar, hindi sila rin naman mabigyan doon dahil hindi sila doon nakasensus. Sila po ay pinapadala namin ng cash assistance through GCash, Paymaya, Cebuana, Luwilier, Smart Padala at iba pa. Ganon din po sa edukasyon, siniguro rin namin. Marami tayong mga kabataan ngayon na nagsisipag-aral, walang pera ang mga magulang. Nagkaroon po tayo ng special program for employment of students. Ito po ay 110 students kung saan tumanggap sila ng sweldo na 9,000 to 10,000. Malaking tulong po ito para sa kanilang pag-aaral dito sa amin. Ganon din po, nagbigay tayo ng cash assistance sa ating mga college students na scholars at sa ating mga magulang ng daycare students. Tinulungan din po natin dahil ngayon sa amin po ang mode ng pag-aaral ay modular. Ibig sabihin po yung mga modules piniprint, pinapadala sa mga bata at doon sinasagutan sa tulong ng kanilang mga magulang. Pero paano ka makakapagpadala ng module kung hindi mo siya marireprint? Kaya po bumili ang pamahalaan bayan para maipamahagi sa mga paaralan ng printing na copying machine para sa kanila. Ito po ay para magkaroon ang aming mga bata ng mga kopya para dun sa aming module. Wala po masyadong internet dun sa mga labas ng aming bayan. Ganun din po, nag-appoint po tayo. Ang tawag po namin para teachers. Para pong paralegal, ito naman parang teachers, para teachers. They're the learning delivery mobilizers. Yung pong mga bahay na ang magulang hindi kayang turuan ng anak, sila po ang pupunta kung hindi kaya ng guro. Sila ang magtuturo at aalalay dun sa mga bata. Meron po tayong inilaang pondo at nakapag-appoint po tayo ng ating mga learning delivery mobilizer. Tawag namin LD mobilizers. Kaya po sa mga ginawa natin ito, binigyan po tayo ng DepEd Region 4A ng The Best Ka Award. Ganon din po, ngayon, araw na ito, umuulan dito sa aming bayan at binabaha ang iba naming mga lugar. Kaya kahit po may ganitong pandemya, kailangan pa rin ho naming rumisponde para makatulong sa aming mga kababayan, makapagbigay ng food and relief assistance doon sa mga naapektuhan naming constituents. Ito po, dadako ako dito sa COVID-19 aid reporting and expenditure summary. ang gusto po natin ay magkaroon ng isang bukas at mapagkalinga, tapat na pamamahala sa bayan namin ng Gomaka. Ito po ay na-inspire kami dun sa ginawa ni Ken at ni John, si Kenneth Abante at John Michael Lava, para dun sa COVID-19 Citizen Budget Tracker. Parang nagkaroon din kami ng Citizen Budget Tracker, pero hindi ang mga tao ang gumawa, kundi ang pamahalaang bayan na mismo para makita ng mamamayan saan namin ginagastos ang mga pondo na dumarating at pondo ng aming pamahalaang bayan. May link po yan, i-click nyo. Anytime, ina-update po namin yan para malaman kung saan pumupunta ang pondo. Makikita nyo po dyan yung sources ng aming pondo. Meron pong galing sa aming local fund, meron pong galing sa national government, at yung cash donations. Yung pong social amelioration program ng pamahalaang nasyonal, naging napaka-kontrobersyal dahil maraming nagsasabi, pinipili lamang, hindi sila nabibigyan. Sa aming pong bayan, we were given ng SAP, ng beneficiaries na 13,434 households. Submit po kami ng mga dokumento, kaya lamang ang nabigyan. Ang na-approve lamang ng DSWD ay 12,261. Pag binuksan niyo po itong aming Gomaka Cares, makikita niyo po ron sino ang mga naka-receive para hindi naman po tayo ma-question kung kani-kanino lang binibigay. Ito po, nakapagsoli pa kami ng 7 million sa DSWD National dahil hindi na ho nag-qualify yung iba dahil sila ay maaaring 4-piece o social pensioner. Yun naman po mga social pensioners, nandito rin po makikita nyo rin kung sino yon at kung ano yung kanilang mga natatanggap sa social pension. Yan po yung aming distribution, may social distancing at maayos, hindi nagkakagulo ang mga tao. At ito pong lahat ng aming mga pondo, iniharap po namin ito sa Municipal Development Council at sa mga civil society group para aprubahan po nila. Dito nyo po makikita, siguro sa Metro Manila ho, naririnig ko sa aking mga kaibigan, ang gaganda ng mga relief goods na binibigay. Pero sa amin po, dahil maliit ang pondo, makikita rin nila magkano ba yung bili namin ng bigas, magkano yung bili namin sa hotdog, sa itlog at sa iba pa. No? At yan, bubuksan mo lang, makikita nila ano yung mga ayuda na natanggap ng aming mga kababayan. Pati na rin po yung mga pinansweldo natin sa ating mga health warriors at ibinigay na financial assistance sa mga displaced workers tulad ng mga street vendors, bus vendors, tricycle drivers. Dito rin po, makikita kung saan natin iba pang ginastos yung pondo. At kami po ay naka-receive ng cash and in-kind donation mula sa business sector, NGO, and private individuals. Napakaswerte po ng bayan namin. Marami po nagbigay ng donasyon kahit ganitong pandemya. Umabot po sa 1.3 million ang natanggap namin mula sa private, non-government organization at business sectors. At yan, makikita po nila ng mga nagdonasyon, isang click lang, saan namin dinala at ginastos yung pong aming natanggap na pondo o na private donation. Ganon din po, yung mga in-kind na donasyon, nandito rin po yan, at makikita rin po kung saan namin sila ipinamigay. Gusto po namin bukas ang aming pamamahala at alam ng mamamayan. Ano po yung aming lesson and challenges na nakita ngayong dumaan ang pandemya? Kahit ho, masabi natin ang tao ay resilient, sa harap ng ganitong hirap, talaga pong naghahanap sila ng serbisyo ng pamahalaan. Kaya nga po kami, sa limited budget namin, natutuho kami na kung paano ito i-manage at magkaroon ng balancing act sa pagbibigay ng tulong sa vulnerable sectors, pero pagbubukas ng ekonomiya na merong ini-enforce na health protocols. Naranasan din ho namin yung mga diskriminasyon, misinformation, fake news, at syempre kasali naman ho dyan dahil nandito tayo sa public service, yung pamumulitika ng iilan. Nawawala yung real essence ng bayanihan. Pero naisagawa po namin na ma-establish yung co-ownership with our private sector na hindi lamang ho kami ang magtatrabaho rito. Kaya po ang dami naming nakuha ng mga private donations dahil alam nila na hindi namin kaya. At alam nila na bahagi sila ng solusyon. Kaya nga po lagi naming ibinibigay ang pag-asa na kaya natin ito attitude sa aming mga kababayang Gomakenyo. Yung pong yung challenges moving forward na nakikita namin, ito po yun. parang nagkakaroon na ang aming mga kababayan ng pandemic fatigue. Maaring hindi lang sa amin nangyayari yan, maaring sa buong bansa o sa buong mundo na po nangyayari yan. Ganon din po, kausap ko ang mga negosyante, ang mga nasa palengke, meron po tayong economic slowdown sa aming bayan. Dadagdag pa ho na challenges ay yung nangyayari ngayong natural calamities, pagbagyo, and other man-made calamities. Pati na rin po yung adjustment natin sa education sector na kung saan ang aming mga kababayan ay naka-module system ng pag-aaral. Di natin alam kung ano magiging epekto nito sa susunod na taon na maiiba na ito at kung makakahabol sila doon sa mga online o sa mga ibang mode ng pag-aaral ng mga bata. Ganon din po, dahil padami pa ito, hindi ho ito sa pawala, 131 na po ang nag-positive sa amin, yung pong management ng COVID-19 patients. Yan po ay challenge pa rin sa amin. At syempre, siguro pinag-uusapan ho ito ngayon at ito rin ay pag-uusapan namin dito, yung Christmas season. May simbang gabi, isa ho sa pinag-uusapan yan ngayon national. Ganon din po, syempre, dahil Pasko, alam ho natin sa hirap ng buhay, ang tingin ng mga kababayan namin, pag mahina ang kanilang pinagkakakitaan, malungkot ang Pasko. So ito po yung challenge na sa amin, sa ating lahat, na magkaroon ng isang masaya at nagmamahalang Kapaskuhan. So, tinitingnan ho namin anong mangyayari sa 2021. Magkakaroon na ho ba ng vaccine? O meron pang second wave itong COVID-19? Ang virus ho ba ay magiging mas potent? Wala pa ho tayong sagot talaga dyan. Kaya kailangan ho natin yung ekonomiya natin palakasin, pero may pag-iingat, may resiliency, magdagdag ng pondo sa mga local government. Nakakaingit po pag mayayaman yung mga cities, ang binibigay po spam at iba't ibang magagandang mga produkto. Kami po rito, pag munisipyo ka, maliit ang pondo mo, talagang kailangan may balansehin mo ang pagtulong at magkaroon pa kami ng mga iba pang income generating programs. So ano po ang dapat nating gawin? Lagi po namin sinasabi, let's embrace na the new normal. Let's take care of our physical and mental health. Mahalin natin ang ating pamilya. Suportahan natin ang mga local farmers, ang mga local naming mga tindahan dito sa aming bayan. Kung kayang mag-save, kung may kinikita, dapat talaga mag-save. And then let's practice random acts of kindness sa ating mga kababayan. At higit sa lahat, at pinaka-importante, tayo po'y patuloy na manalangin. Matapos na yung pandemyang ito. Pero hanggat nandyan ho yan, hindi ho kami mapapagod. Kahit po kami napapagod, hindi naman po kami susuko. Maraming salamat po at magandang hapon sa inyong lahat.
Maraming salamat, Mayor Webb, at maraming salamat sa iyong insightful at informative na presentation. Pinakita mo sa amin yung iba't ibang aspeto ng pagtugon ng municipal government of Gomaka problema o sa hamon ng COVID-19. Now, at this point, we would like to invite once again Mayor Litargo and Dr. Batangan as we extend our conversation to our audience. And as I check our chat box, meron na po tayong ilang mga katanungan, no? Siguro, umpisahan po natin. There's a particular question that is addressed to Dr. Batangan, no? And yung pong tanong ay may kinalaman po dun sa contribution and value or yung role ng ituro as an IPC program or bilang isang programa po na, shall we say, may malawak na saklaw. Ano po, Doctor? Sa tingin ninyo, what might be the contribution or the value of the ituro program in a post-COVID Philippine society? Nabanggit po kanina, no, ni Mayor Litargo that they're also looking forward to a post-COVID situation. In your opinion, Dr. Batangan, what would be ituro's role now in that kind of a situation?
Salamat sa katanungan, ano? Salamat din ninyo and pagbati muli kay Mayor Litargo, no, sa magandang pamumuno, no, sa Gomaka. Katulad ng nasabi ni Mayor Litargo, no, we're looking forward to a situation that probably will be more predictable, no, in terms of the public health situation. And we don't know when will that happen at ano magiging ang ang tsura no, ang figura ng ganung klaseng sitwasyon. Pero doon sa tanong na kung ano ang magiging o nakikita ang papel ni Ituro doon sa panahon na yon, ay nakita namin yung pagpapatuloy nung ginagawang paglalatag ng mga paksa na nakakatulong sa tingin namin or sa mga request na natatanggap namin ay kailangang ipaliwanag o maintindihan ng ating mga tagapakinig o tagapanood ng Ituro. Nung nagsimula yung Ituro, sinubukan namin i-focus yung discussion at saka yung mga topics sa mga health workers primarily. Kasi yun ang panawagan noon at saka ang tingin noon yun yung mas nangangailangan ng mas marami pang at mas mabilis na impormasyon. Marami namang sumali at naging bahagi ng Ituro ng mga health workers. Pero nakita rin namin na malaking bahagi ng mga dumalo or naging participants ng Ituro ay mga galing sa mga kolehiyo, mga state universities and colleges. At nakita rin namin na dumami yung mga participants na nasa labas ng Maynila, particularly sa Visayas and Mindanao. At isa sa mga naging obserbasyon sa IPC at ng mga kasamahan natin dito sa Ateneo ay nagkaroon ng pagkakataon yung ating mga kababayan, lalo na yung siguro ang mga interesado nga yung mga nasa universities, na tignan yung mga paksa or makipagtalastasan doon sa mga resource persons natin sa mga paksa o mga topic na parang nung siguro before the pandemic hindi napag-uusapan or walang available resource person na pwedeng maging resource person ng ating mga kababayan. Pero ngayon with the use of technology and the platform, naging available yung mga resource person. Kakausap natin si Dr. Libiste ngayon through online across the country. Si Mayor Litargo nung nag-webinar siya and the other online platforms that he has been speaking, naririnig siya ng mas maraming kababayan natin. Siguro sa Ituro, itutuloy lang namin yun. Pero meron kami pinag-uusapan ngayon na parang how do we further intermediate the processes that we have seen in the initial phase. Hindi pa konfirmado yung pinag-aaralan pa namin, pero pag sinabi kasi nating better normal or build back better, whatever we call it, may mga pangangailangan na parang kailangan may nagbabandila nung ganung klaseng pananaw at transformation parang tinitingnan namin ngayon ay papaano pwedeng gawin ni Ituro yun sa pamamagitan ng platform at saka nung audience na naabot na niya. At resources na available din sa atin through, of course, Ateneo and through our partners, particularly sa Department of Science and Technology. I hope nasagot yung talong medyo mahaba rin yung kasagutan ko. Salamat ulit.
Maraming salamat, Doc Dennis, sa pagpapaunlak. Hindi lingid sa kaalaman ng karamihan na malaki yung naitulong ng Ituro program, hindi lamang sa pagpapahayag o sa information dissemination about universal healthcare and about related public health issues and topics, lalo na sa panahon ng pandemya. Hindi naging lingid sa kaalaman ng karamihan. At malaki rin yung naitulong niya in terms of providing a steady flow of information. Kagaya nga nung sabi niyo kanina, hindi lamang dito sa loob ng Ateneo, hindi lamang sa Kamaynilaan, kundi lalo't higit at mas mahalaga sa mga probinsya at sa iba't ibang rehiyon, may yung sa pamamagitan ng mga partners natin sa ASEAN. So maraming salamat doon, Doc Dennis. Ito naman pong sunod na katanungan natin ay addressed kay Mayor Webster. Unang-una, kino-congratulate kayo sa maraming programang na-implement sa munisipyo ng Gomaka. At yung tanong ay kinalaman sa role ng research during pre-implementation, implementation, and possibly post-implementation ng mga proyektong inyong nabanggit. So, Mayor, kwentuhan nyo kami in a way sa tingin ninyo, saan pumapasok yung kahalagahan ng pagsasaliksik sa pagpaplano at sa implementasyon nitong mga programang lubhang nakakatulong talaga sa inyong mga kababayan sa Gomaka?
Opo. Una ho, napaka-importante ng data para malaman natin. Meron po kaming RCBMS na pinapatupad dito, yung nagkakaroon po kami ng pag-ikot ng aming mga tauhan para sa mga bahay-bahay para malaman nila yung nare-research nila, yung pangangailangan ng aming mga kababayan. Tapos pangalawa po, importante rin po yung mga ganito na Zoom meeting, webinar na na-attenda namin dahil nakikita rin ho namin, halos pare-pareho kami ng problema ng iba't ibang LGUs. At yun po ang nakakapagbigay sa amin ng idea. Napakaganda ho, sa kaya natin, we always have a seminar every Saturday. Tapos po yung local government academy. Ang dami ho naming napapag-alaman. And then dito ho, inaalam namin ito dahil ngayon, iba ho ang kilos ngayon. Unang-una, bawal lumabas nung nagkakaroon tayo ng mga ganitong programa. Talaga hong titingnan mo lang, naging effective ba ito sa kalapit bayan namin or yung sa kokopyahan namin bayan? O kaya naman, ano ba talaga yung pangangailangan nila? So we always have meeting with our barangay captains, with our barangay officials. Tapos nagkakaroon din kami ng pagtatanong, mga focus group, para maibahagi ho namin yung program. Nakita ho namin, isa sa malaking problema talaga yung doon sa aming mga pag-aaral, yung mental health na minsan nalilimutan ng iba na ito ay problema. Kala ho nila, basta nabigyan mo ng relief, okay na yan. Pero ang bigat ho nung problema sa mental health, kaya kailangan mabigyan din sila ng tutok ang aming mga kababayan.
Maraming salamat, Mayor Webb, no? At least na-highlight mo kung ano yung kahalagahan ng, kung tawagin natin ngayon, yung data-driven na hakbang, no? Lalo na when it comes to local governance, no? Tapos meron pang dalawang katanungan dito na palagay ko masasagot ninyong dalawa, no? Mayor Webster, Dr. Batangan, no? At yung unang tanong dito, what are the challenges in providing information? Halimbawa po sa larangan ng edukasyon tungkol sa pandemya, sa paggamit ng mga pondo, no? As a project and as a local government, provided that face-to-face interactions are restricted. Ulitin ko po what are the challenges in providing information, no, as a whole in a local government setting now that the face-to-face interaction is obviously restricted and limited?
May na, sir? Doc? Sir
Doc
Dennis?
Dennis, sige.
Sige. Salamat, Mayor. Salamat ninyo. No? Yung challenges na nakita natin, of course yung gumagamit tayo, for example, sa ituro ng teknolohiya, gumagamit tayo ng online platform. Meron tayong mga kababayan na limited ang access or walang access at all, no, sa ganitong teknolohiya. Ngayon, yun namang mga merong access, minsan ang problema naman nila yung connectivity, no? So assuming na makakonect sila at makaparticipate sila dun sa they are confronted with a learning situation na bagong-bago. Parang yung experience ng ating mga estudyante ngayon, no, na bigla silang gagamit ng platform na bagong-bago at hindi sila binigyan ng panahon, o hindi nabigyan ng panahon para matutunan kung paano gamitin itong mga teknolohiyang ito. Yung isang malaking pagbabago dito ay yung wala kang kausap. Parang ngayon, parang nag-uusap tayo pero kaharap ko computer, no, na nakikita ko kayo pero iba yung kaharap ko talaga kayo na nakikita ko yung or physically magkakaharap tayo. Sa marami sa atin, malaking bagay yung hindi personal yung pakikipag-ugnayan, pakikipagtalastasan. At marami ring nangyayari in between, no? Pagdaan ng impormasyon sa teknolohiya, sa platform, dami pwedeng mangyari diyan, no? So from mali yung maintindihan mo o dahil may delay o hindi tama yung yung paglalapat ng tunog doon sa imahe, pwedeng magkamali ka ng interpretasyon, no? So maraming variables na kailangan nating intindihin at overcome, no, with regards to this new So yun mga challenges ng Pagkatapos yung credentialing, no, parang kung gusto nating bigyan ng kahalagahan itong ganitong klaseng kailangan may kabit din natin siya doon sa pagbibigay ng credits, no, doon sa panahon na inuukol ng ating mga participants doon sa platform na yon. Sa DepEd, for example, mandated na yon, no, na may credits yon, pero ang dami pa ring issues na kailangang resolbahin. Sa usapin ng mga professionals, no, ang sinubukan natin sa ituro ay magkaroon ito ng tinatawag nating continuing professional education units. So for that, kailangan naming magkaroon ng representation or ng certification and approval sa Professional Regulations Commission. Na at that point, no, ngayon sa simula ng COVID situation natin, hindi sila handa na magbigay ng professional development units para sa mga trainings na ginagawa online. Ngayon lang nito siguro mga recent months naging mas bukas, no, yung Professional Regulations Commission para bigyan ng unit yung ating mga professionals who are taking these courses through online platforms. Siguro yung isang malaking shift, no, na balikan ko yung sa unang punto. Isang observation ito ng isang parang innovator din, no, on e-learning platform. Sabi niya, yung tayo daw mga tao, tayo yung hindi lang mga Pilipino, parang over the since time immemorial, we have been trained yung system natin to interact actually in a face-to-face setting. Ibig sabihin, yung cues natin, yung interaction natin, yung pag-frame natin ng mga issues ng was built and was optimized with a person-to-person interaction. So shifting to an online platform would actually kailangan yung ating buong sistema, yung ating buong pananaw at saka yung ating response mechanisms actually needs to adapt, no, to those new modalities and new platforms. So malaking pagbabago talaga yon. Parang sa simula parang okay lang na mag-web tayo, webinar na pero hindi natin napapansin over time na parang dahil hindi tayo we were not parang designed, no, for these types of interaction. Maraming nangyayari sa natin, sa sistema natin, hindi lang sa pag-iisip, hindi lang sa pananaw, hindi lang sa pakiramdam, no, na parang bago lahat, na kailangan nating maintindihan, kailangan nating mapangibabawan kung gusto nating maging functional in this particular setting. Yun lang. Salamat ninyo.
Maraming salamat, Doc Dennis. Mayor Webb?
Sa akin naman po, yung localized setting, para makapagpaabot kami ng komunikasyon o mensahe, napakaswerte ho natin ngayon, nangyari ito, meron ng social media. Meron na tayong platform na magagamit. Saka naman po nakakita na Mayor, nag-a-announce sa Facebook Live, pero dahil dito sa pandemyang ito, wala hong nagawa ang tao kundi doon maghintay. Especially po, every 15 days, kung naalala nyo po, every 15 days, binabago ng national government kung ano ang containment zone natin, kung mayroon na tayong GCQ, ECQ, at iba pa. So dito po, at kami rin naman pong mga local governments, binigyan po kami ng kapangyarihan na i-lockdown ang aming mga bayan, magkaroon ng mga katulad po ng liquor ban, curfew. So ito po, kailangan nilang malaman. And we use social media like Facebook Live as a platform. Ganon din po, makikita rin nila doon. Kaya nga po meron kami nitong Gomaka Cares para alam nila saan doon pumupunta ang ginagastos ng pamahalaang bayan at ano yung pinamimigay ng pamahalaang bayan. Ang hirap lang po dito na challenge yung mga wrong information, mga fake news, at iba't iba pa, no? Especially nung umpisa, nung ginakapapa natin si COVID-19, may naglabas na yung saging daw gamot sa COVID. Grabe ho, ang sa amin naging 120 ang kilo ng saging. Naniniwala ho ang tao. Kahit alam nilang kalokohan lang sinasabi sa social media, but because they want to yung napaniwalaan kung ano yung sinabi dahil pwede palang maggamot ng saging. So yung mga ganun pong mga problema, kailangan din ho naming basagin. At kagandahan nga ho ngayon, naging sabi na rin po, pati DOH, they have their own mga social media cards na mas madaling naiintindihan ng tao, yung BIDA at saka yung DILG naman, yung disiplina muna. So ito ho, parang nagkaroon tayo ng pagkakaintindihan lahat na kailangan na natin gamitin lahat ng platforms, hindi lamang ang radio station, kundi ang social media para maintindihan ng tao. Pero tama po yung sinabi ni Doc Dennis, ang hirap po mag-meeting ng Zoom na alam mo namang malapit lang sa'yo yung kakausapin mo. Kailangan, nasanay ho talaga kami na personal. Even yung mga mayors ng lalawigan ng Quezon, imbis na mag-Zoom kami, nagmi-meeting ho kami na nagkikita-kita. Kaya there was a time na may nag-positive na mayor, lahat kami na-quarantine. Kaya importante pa rin po ito yung paggamit ng ganitong ibang pamamaraan para na rin makapag-iingat ang lahat.
Okay, maraming salamat, Mayor Webb, no? We're down to our last two questions, no? May pahabol ho dito sa text, na may nag-text po sa akin. Yung huling tanong po dito sa chat box, kung mababasa ninyo is, how do you see the management of COVID-19 in the context of other calamities that may challenge our current COVID-19 prevention measures? Kagaya nga po nung nabanggit niyo, Mayor Webb, kanina, sa kasalukuyan, meron din po tayong binubunong bagyo, lalong-lalo na sa inyo po, ano, sa Gomaka, no? Maaari po bang makapagbigay din kayo ng inyong ideas or insights pagdating sa usaping ito? At mamaya tatanungin din po natin si Dr. Batang.
Opo. Katulad po ngayon ay may pagbaha po nangyayari sa aming mga barangay. At ito po, nangyari rin nung bagyong Opel, ngayon bagyong Pipito, magkasunod. Maaari may mga iba pang darating na bagyo. Talagang makikita mo yung ating mga responders, yung ating mga barangay officials. Kahit napapagod po yan, wala akong magagawa eh. Tatrabaho po yan, kailangan gawin. Kaya ito po, with yung maliit namin pondo, na talagang hahati-hatiin namin, pinipilit po namin at maitulong. Ang kaibahan nga lang ho, ngayon, dahil bukas ang ekonomiya, medyo nasanay na rin ang tao sa new normal, medyo nakaka-adjust na. Pero kung ito po yung nangyari noong March, April, May, nagsabay-sabay, lalo ho ang mental health ng aming mga kababayan, baka hindi ho kayanin. Pero ngayon, medyo naaalis sa kanilang focus yung COVID, napupunta sila dito sa mga pag-aayos ng mga bahay nila, pagbaha, paglubog ng kanilang mga gamit. At ito po medyo nakakaya kasi nababalanse. Pero hindi ko po alam yung magiging epekto pa nito sa mga susunod na panahon.
Okay. Maraming salamat, Mayor. Doc Dennis?
Yeah, can you pakiulit yung tanong ninyo?
Sige po. COVID-19 or yung, shall we say, how to address COVID-19 in the context of calamities. Kasi parang ang sinasabi po dito, merong added burden or may added challenge. Ano po? So, ano po yung masasabi nyo tungkol dito, Doc Dennis?
Yeah, actually yung situation natin ngayon, no, we are in a state of calamity, no, yung ating bansa. If you remember, no, si Pangulong Duterte in-extend yung parang declaration of a state of calamity for the country until next year, no, 2021, no, I think until September next year. That means that yung ating mekanismo sa pamahalaan at saka doon sa pagtugon sa mga kalamidad ay in place. No? That's the reason na nasa IATF context tayo. Yung Interagency Task Force on Emerging Diseases, Emerging Infectious Diseases, is actually an entity under the OCD, no? Office of Civil Defense, which is actually the one in charge during calamities. So because of that, nasa perpetual, hindi naman perpetual, kung hindi nasa mahabang panahon tayo ng parang state of calamity. Having said that, yung response mechanisms ng Estado, should actually be prepared for this calamity and the other calamities that we usually encounter or we usually experience. So in a sense, nakahanda, no, yung ating pamahalaan because nasa state of calamity na nga. Pero that does not mean na parang dapat ay maging ganun na lang yung framing or yung pananaw o yung response mechanisms natin. Kasi yung nararanasan natin ngayon sa panahon ng COVID ay parang continuous or tuloy-tuloy na kalamidad, no? Kumpara doon sa mga ibang kalamidad na parang pagkatapos ng lindol, for example, no, maraming pinsala, pero nagre-rebuild ka na, no, nung baha, ganun din sa bagyo. Pagkatapos ng lumampas ng bagyo, sabi nga ni Mayor, mag-aayos ka na ng aalisin mo na yung pumasok na tubig sa bahay mo, mag-aayos ka na ng mga napinsala. May parang aspeto ng recovery, rehabilitation and recovery. Pero yung kaibahan nitong COVID na is parang hindi mo alam kung saan ang gagaling at kailan ka pwedeng tamaan nung sakit, no, nung pandemya. At ang mas masama, hindi mo alam kung anong gamot, no, for this particular so kaya maraming anxiety, maraming fear. So kumbaga yung pagkakaroon ng ganung state of calamity sa konteksto ng pandemya ay bago sa atin. Kung isasabay pa natin yung mga ibang kalamidad na nararamdaman ng parang hindi mo alam kung paano aahon or paano ilulugar ng tao yung kanyang coping mechanism. Maganda yung sinabi ni Mayor kanina na let's look forward, let's look forward for Christmas, let's look forward to the better things that will happen in the kasi yun din naman yung sinasabi sa atin ng ating mga psychosocial experts, no, na may problema, may sitwasyon na ganito, pero hindi naman ibig sabihin na titigil lahat o yun lang dapat ang pag-usapan natin. Pag-usapan din natin at tignan din natin yung mga pangyayari, yung mga bagay-bagay na positibo o nagbibigay pag-asa sa atin. Kasi nakita naman natin, no, na across all these difficulties na naranasan natin, merong pamamaraan, no, na nagagawa tayo individually, within the family, within the community, or in the case of the Gomaka, may local government unit, no, na nagbibigay direksyon at nagbibigay at nagbibigay ng ang pag-asa, no, doon sa mga kababayan natin doon sa mga panahon na ganito. So I think yung karanasan pa rin natin bilang mga Pilipino, bilang mga individual, ang magbibigay din sa atin ng parang insights, no, kung paano natin haharapin at paano natin malalampasan itong pandemyang ito, at saka kung may mga kasabay pa siya, malalampasan din natin.
Okay, maraming salamat, Doc Dennis, no? Bilang panghuli, itong tanong ay nagmula kay Professor Mary Racelis, no? And I think akmang-akma na kay Mayor natin itanong itong huling tanong na ito. Ano po? Is there a systemic policy in the Department of Interior and Local Government, knowledge and experience to other LGUs to show that it can be done, no? At kino-congratulate po kayo ni Dr. Racelis sa admirable program ng Gomaka, Quezon, Mayor.
Sorry, sir, nag-lag. Pwede pong patanong ulit. Naputol.
Sige. Kung meron daw po bang systemic policy, Mayor, ang DILG para ma-disseminate yung kaalaman at yung karanasan ninyo kita ng ibang LGUs na something is working, no? Na ari pa lang gawin ito, no? At kino-congratulate din Dr. Racelis sa admirable program ng Gomaka, Quezon.
Dr. Racelis, thank you po. Una po, hindi po DILG lang. Ito pong aming Gomaka Cares, yung na-inspire po kami doon sa COVID tracker nila Ken and John. Ito po ay nakita ng BLGF, yung Bureau of Local Government, sa Department of Finance. At sila po, nagbigay na sila ng memo sa lahat ng mga bayan, ng mga LGUs, na kung maaari gayahin yung aming ginawa po para naman makita rin sa ibang mga bayan. Kaya tuwan-tuwa po sila, in-interview po nila kami, tapos meron po silang pagtatanong sa aming team para kung paano gawin ito para naman sa ibang bayan. When it comes to DILG, marami pong mga local government na maraming magagandang ginagawa. Meron po kami yung sa Local Government Academy na may mga nagpe-present ng magagandang mga programa. Ganon din naman po yung sa amin sa Kaya Natin. Ay nakakapag-present din po kami doon ng mga magagandang ginagawa. So sabi nga ho namin, wala hong problema ng mangopya. Copy and steal everything when it comes to ideas that can help your constituents. Wala hong problema yon. Kaya kung may kokopya doon sa ginagawa namin, we're more than willing to share it po. At ganoon din naman, nakakakita kami ng programa sa ibang bayan and we ask them on how to do this and they ano naman po, more than willing din na ibigay sa amin.
Okay, maraming salamat, Mayor Litargo. So muli po, we would like to thank our distinguished resource speakers for this afternoon. Dr. Dennis Batangan, Research Associate of the Institute of Philippine Culture, Ateneo de Manila University, and Mayor Webster Litargo of the Municipality of Gomaka, Province of Quezon, for generously sharing their time with us this afternoon. Pareho po silang abalang mga tao. Marami po silang inaasikaso, marami po silang mga proyekto, pero minarapat po nilang makasama tayo ngayong hapong ito. So on behalf po of the Department of Sociology and Anthropology of Ateneo de Manila, as well as the Anthropological and Sociological initiatives of Ateneo, muli po kaming nagpapasalamat sa ating dalawang resource speakers, Dr. Batangan, Mayor Litargo, at gayon din po, nagpapasalamat din po kami sa ating mga participants, yung mga suki na po ng ating DSA webinar series. Nais rin po naming bigyang pugay at pasalamatan yun pong online learning communities ng Institute of Philippine Culture na siya pong nagsilbing, shall we say, gabay at inspirasyon para po manganak itong mga webinar sessions na ito sa Ateneo. So on that note po, muli maraming salamat, mag-ingat po tayo palagi at magandang hapon po sa inyong lahat. Mayor, maraming salamat.
Salamat po. Anytime po, anytime.
Yes.
Salamat,
Doc,
salamat.
Doc Dennis, maraming
Sige,
salamat.
salamat ninyo. Salamat. Salamat, Mayor.
Salamat po, Doc Dennis.